not every hyperglycemia is diabetes, and not every elevated blood pressure is hypertension, and not every seizure is epilepsy. Diabetes mellitus, hypertension, and epilepsy are chronic diseases which need special diagnostic criteria to be fulfilled for proper diagnosis of each of them, because we have what we call non-diabetic hyperglycemia, which is sometimes associated with acute conditions like acute myocardial infarction or some CNS disorders, especially intracranial vascular problems like in subarachnoid hemorrhage or in intracerebral hemorrhage, may be associated with glycosuria and transient hyperglycemia, which is mostly related to the stress associated hyperglycemia, which occurs in association with such stressful conditions, CNS or acute cardiac insults, and also sometimes in relation to drugs, what we call drug-induced hyperglycemia, that is iatrogenic. Same also with elevated blood pressure. When we find an elevated blood pressure in an individual, this doesn't mean that he has or she has an established hypertension, whether primary essential hypertension or the less common secondary hypertension. This might be related to some sort of stress or some other acquired condition or a drug, for example. Same also applies to what we call the non-epileptic seizure disorders, and I already had a live broadcasting about this condition before, the epileptic versus non-epileptic seizure disorders in clinical practice. So beware, not every hyperglycemia, again, I repeat again, not every hyperglycemia is diabetes. That is diabetes mellitus, and not every elevated blood pressure is hypertension, and not every seizure disorder is an epileptic disease or epileptic syndrome. These medical disorders are chronic medical diseases: diabetes mellitus, hypertension, and epilepsy, which need specific diagnostic criteria to be fulfilled for diagnosis of the disease. It's not by finding a biochemical abnormality or an abnormal clinical reading or an abnormal clinical description. It needs to be fulfilled diagnostically by what we call diagnostic criteria for diagnosis of diabetes syndrome, or for diagnosis of hypertension, or for diagnosis of epilepsy. Thank you so much.